There's 10 billion with a B, $10 billion of help for the CDFIs and the MDIs, minority depository institutions, to build their capacity. This is for capacity building for underbanked and underserved communities, and an additional $2 billion for direct grants from these CDFIs and MDIs to small businesses. So we recognize that access in parts of our state, in underbanked communities, minority communities, rural communities, that we need to have greater capacity to assist these individuals that live there to be able to participate in economic growth. And it helps all of us. So we are committed to that.
Okay, thank you.
Senator Cardin, I too want to say thank you for all that you do for us and for the Eastern Shore. Glad you're safe. And thank you also for the funding for broadband. You know that the pandemic has really highlighted and expedited the need to be able to get us all connected. So please keep that in mind. I know you will. And as we work forward to make sure everybody can get a reliable and accessible as soon as possible access. Thank you.
Well, thanks for that point. And you're exactly right. We did take a major step forward on broadband. There's $3.2 billion, again with a B, dollars that were made available through the FCC for new emergency broadband benefits. This is to recognize that we saw during COVID-19 the gaps in connectivity in our society. So these are funds that go to the internet providers to help low-income families get access to broadband. So we've made a substantial step forward in regards to access to broadband. It's true in every community in our state, we have issues of connectivity, but it's particularly challenging in rural areas because of the population density issues and profitability. So we really do need to build up the ability of every household to get broadband internet service. There's also $300 million for broadband connectivity for local governments. So this is where local governments can partner with internet providers. And these are grants. So so many of our local governments have really stepped up to the plate on broadband, and this will give them another tool to be able to move that program along a little bit faster. And there's some additional monies in regards to mapping because we don't have all the information about where the gaps exist. So this was a good first step. It's not the last step. We need to do more.
Thank you so much.
Chairman Ahrens, this is Chris Adams. Senator Cardin, I was pleased to hear about your chairmanship with the Small Business Committee, and I'm a small business owner, and my sort of one-trick pony act here in Annapolis is I'm in economic matters and advocate for small businesses. So I'm truly encouraged and excited about the opportunity to watch you work in that environment. You know, some of the challenges that we have as business people are not only going to be financial in nature, but also regulatory in nature. And the only thing I've ever asked of leadership in Maryland is if we're going to pass laws, make them workable, you know, give small businesses clear paths to compliance with those laws. I'd love to work with you to the extent that that's appropriate to advocate for those principles. And again, thank you for your service. And I would echo Senator Hershey's comments at the outset. We're better than that as a country, and look forward to working within my role as a legislator to bring a better level of discourse, if you will. So again, thank you, and look forward to working with you moving forward.
Well, I accept your offer to help us in regards to the practical impact dealing with small businesses, and regulatory relief for small businesses is high on my priority list. The regulations that can be complied with by larger companies, there needs to be consideration for smaller companies, and I agree with you. I also want you to know that I've already made overtures in regards to access to capital so that the banking committee takes into consideration small businesses as they deal with the banking regulatory structure to make it easier for small businesses to access capital. I also serve on the Senate Finance Committee, and I've already talked to the leadership of the Finance Committee as we look at tax reform, it's wonderful to get the corporate tax rate reduced, but most small businesses pay the individual tax rate. So we need relief in our tax code for our small businesses. And I'm looking at doing something in regards to the tax code to help small businesses. And then lastly, on trade, we really have sensitized all of our global activities. And you may not realize it, but most of our businesses are somewhat involved in the global community. Even if you're a small restaurant, you have to be able to get your supplies, and your supplies come in many cases from outside the United States. So we want to make sure that our trade policies are sensitive to small businesses. And I expect to take a very active role in that regard. So there's lots of different areas that we're really working, because small businesses are the growth engine of America. That's where jobs are created. And just as importantly, small businesses are much more innovative. They figure out better ways to get things done. So we really need to have a more favorable climate in this country for small businesses.
Other questions?
Chairman Aaron's, it's Johnny Mounts.
Go ahead.
I'll be very quick. Senator Carter,
Well, you've never been quick.
I'll be quick. Yeah, and I'm glad everyone had words of support for you. I know thoughts and prayers are with you. But real quickly, congratulations on taking the gavel for the Small Business Committee. That's fantastic. Just wanted to put on your radar screen the seafood industry, both now it's the middle and the harvesters. They are all in a very, very bad spot right now, and there's no silver bullet to fix their challenges. But with the oyster season and the impact on the markets around the country, I think they're in a way that I really can't explain. And they're all small businesses. So I just wanted to make sure that they were making it to your attention, because I think they're at the point where they really aren't even able to organize to explain what the challenges are they're facing. Yeah. And as you're moving forward, over the course of this year, I cannot say enough praise to our small banks here on the shore who have stood up to help small businesses. If you look at the PPP and what banks actually help the businesses on the shore, I think you'll be so proud to see Providence State Bank, Hebron Bank, Shore United. That's right in our District 37B. But if you go outside, you're going to find these small banks really did the work to help these businesses. And as we move forward, we're not through this. Hopefully they'll be there for you. I know they were hurt. They had a tough time a few years ago, and they've really come back, and they've stepped up to the plate for the country and for the state and for all their customers.
Well, Johnny, thank you. And thanks for pointing out our community banks. Community banks are critically important. Their survival is not guaranteed. We see that the larger banks are all moving into try to take over our community banks. And I'm a huge supporter of maintaining our community banks. I do want to point out a great victory for the Eastern Shore, both on the seafood and poultry industries. The original CARES Act that was passed in mid-March, the direct assistance to help these businesses excluded our seafood industry and our poultry industry. Our poultry industry because of the way it's organized, our seafood industry because of definition. We went to work. I took the leadership in our delegation, but I worked with senators from other states, working with Senator Van Hollen. We were able to get the changes in the legislation that we just passed so that the poultry industry and seafood industry can benefit from the economic programs, including the purchasing of products and the way in which we are trying to make sure that we get to the other end of this COVID-19 with viable businesses still being able to do business. So our seafood industry and poultry industry will qualify for help under the legislation we just passed.
All right, Senator, I'll just reiterate the comments that we made. We are saddened by what happened in Washington, and we're looking forward to your leadership, I guess, to try to calm that storm down there and bring some peace and tranquility, if you will. But I guess one last question I'll have for you is that I can't tell you how much we appreciate all the federal support coming into our state, but it's going to, at some point, maybe we can have you back again before the end of session. It begs the question about where are we getting all this money? And maybe that's not the right time to ask that.
No.
Certainly everybody's saying yes, 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 but it is a question that's going to come up. And I think it's something that we're all going to have to address at some point.
Steve, thanks for asking that. Thanks for raising that. You're 100% right. And first, let me say that I think my demeanor during these difficult times is as a result of serving in the Maryland General Assembly. So I'll take my my benefits from the years I had in the relationships that were made, and recognizing that when you work together, you can get so much more done. But you're absolutely right about the deficit. At this particular moment in the history of America, we need to put more money into our economy. So we recognize that only the federal government can do that. But when you look at the last 15 to 20 years, by the way, under both Democratic and Republican administrations, we were putting money in the economy when the economy didn't need it. And we created a lot of debt and made ourselves much more vulnerable than we should have. So when we ended up with COVID-19 and we were in a vulnerable position, we were not as strong as we could have been if we exercised fiscal discipline when we had the ability to do that. At this particular moment, no, we're going to put money into the economy, and that's the right thing to do. That was supported by both Democrats and Republicans in the Congress overwhelmingly. 98 to 2, I think, was the vote in the United States Senate. So it was an overwhelming recognition that we had to get our economy back on track. But there's a day of reckoning, and we have to recognize that. And we've got to balance our budget. And we have to do that in a reasonable period of time. We've got to be on a path to make that happen. And it's never easy, and it's never the right time, because there's only two ways you can get a budget better into balance. You either bring in more revenues or you cut spending. There is no other way. Neither one are popular, but we have to do it. And I thank you for raising that. I can tell you that I will be part of a bipartisan effort to deal with the realities of our budget. But at this particular moment, we do need to put more money into our economy. Too many people are not working. Our economy is not on track yet. We've got to come through the other end of this COVID-19 with an economy that can perform. So at this moment, the economists are all advising us that it's still important to stimulate economic growth and recognize, though, let's invest those dollars where you can create good jobs, where you end up with better services. That's why I'm a big fan of Build Back Better. Let's get a much more modern infrastructure at the end of the day, so we have something we can point to that makes America more competitive and improves the quality of life in our country.
Great. Senator, thank you for your time. We're running a couple minutes over, but always a pleasure. And again, I'd like to maybe, if you had some time towards the end of the session, would love to have you back. Thank you
Always
very
enjoy
much.
being with you. Thank you all. Stay safe. Thanks for the courtesies. Appreciate it.
Thank you very mumuch. Appreciate it. All right. I'm sorry we're running a couple minutes late, but at this point, I think we'd like to invite up Dr. Chan from the Department of Health. Dr. Chan, are you unmuted? Can you unmute yourself and come on board?
Yes. Hi, good morning, everyone.
Okay.
Thank you.
One thing for you, if you want to share your screen, I understand you have a slide presentation, or you want to talk from it. Do you want to view that on your
Do you
screen?
have a slide presentation? I should have my colleague, Heather Scheck, also online.
Okay.
And I think she and I were going to just
If
run
she wants to
through.
share that, that'll be fine.
Yes.
Thank you, Delegate. I am trying, but it says the host disabled sharing screen.
Well, the host is going to try to let you do that if we can find you here, but this is
Thank
a
you.
time for all of us. Let me
You
see
think
if
that
I,
after, the 9-10 months that we've been using these platforms that it would get easier, but I find it almost harder because we switch between different platforms. So
I'm actually, you know what, the trouble is I've always been on your side of this screen, never on the host side. So it's, you know what, Dr. Chan, if you want to get started, I'll work on that and try to get that screen up for you. I think we had sent that out to everybody, your slide presentation. So if you have it on, or you know what, I may be able to share that. Hold on one second.
Well, so let me just start by just saying good morning to everyone and Happy New Year. It's mid-January and happy session. I guess we are now 88 days. I think it's been 2 days since session started. So it's a session, of course, that will be more different than any other. Of course, last year it was, cut short, but we're still very much involved, the health department and really agencies across the state. As you well know, local health departments and others involved in the pandemic response. We are seeing some of our numbers increase, and we'll go through some of those numbers shortly. And so just be aware that all of our different efforts, whether it's testing, contact tracing, purchasing of PPE, our support to nursing homes and to assisted livings and others continue, in addition to the vaccine work that we are rolling out, and that we actually started receiving vaccine almost exactly a month ago, December 14th. There's and it's ramping up, and you can see with our numbers we are improving, and so we'll talk through that a little bit. Are you able to pull the slides up, or do you want me to try to do that?
I'm almost there. I believe I'll be there in 13 seconds, but if you want to continue because.
Sure.
Dr. Chan, do you want me to start just going over the first couple slides and we can skip over them just
That'd
in the
be
interest
great.
of everyone? Okay, great.
Thank you. So my colleague, Heather Scheck.
Thank you. Good morning, everyone. My name is Heather Scheck. I am the Deputy Director in Governmental Affairs at the Department of Health. Thank you so much for having us here this morning. As Dr. Chan stated, we are, right in the thick of things, going over and responding to COVID-19. We're actually very proud of the work that we've done thus far. And Delegate, if you could go to the next slide, please.
I'm good.
Oh, sorry. I thought I could see him. I can't tell if I'm looking at my screen or your screen.
I'm trying to give you access to it, but you
Okay.
go.
So as far as testing goes, we have conducted to date over 6 million PCR tests in Maryland. And, we started out back when COVID first hit doing, maybe on a good week, 1,000 tests a week. And we are now averaging about 43,500 tests a day. And so, we're very proud of that. And as we do more testing, we're ramping up the contact tracing, and there have been over 140,000 cases and over 160,000 contacts reached and interviewed by over 1,500 contact tracers in the department. And another really great data point is that about 1.6 million Marylanders have signed up for exposure notification through our partnership with the Google and Apple. And so all new cases receive a pre-call text with a Maryland COVID alert verification code. We've also distributed over 89 million pieces of personal protective equipment, and requests are being fulfilled daily as we speak. And on the hospital surge side of things, we are working very closely with all the hospitals and through the Maryland Hospital Association to make sure that every Marylander who needs a bed has one available. We continue to make advanced medical tents, ICU modulars, and alternate care sites available for all COVID patients. We still have the Baltimore Convention Center going, and that's been kind of a pretty interesting and great site because it offers care for those who need it, but it also is a testing site. And so we're very proud of the work there. And so regarding the hospital surge, where we are now is, as I said before, care is available for every Marylander who needs it. As of the 13th, which I think was Wednesday, Our statewide hospital census was 7,481. And this remains below the first trigger point for hospitals to implement their surge plans. I'm sure you all know that every hospital in the state was required to submit a surge plan to the Department of Health as part of our response and to ensure that we had the capacity that was necessary. And as of Wednesday, there was the COVID-19 census in the hospitals was 1,929 patients. And 24% of those were in the ICU. And the roughly 1,900 patients represents about 26% of all hospitalizations. And I will skip over. We have a great slide that shows you the different trigger points, but basically the first trigger point will be when we reach hospital census of 8,000 folks. And again, we're still about 500 people below that trigger point. And really the goal is to not ever reach that trigger point. Trigger number 2 will be 9,000, and then trigger 3 will be 10,000, at which point we would be in full swing surge response, implementing those surge plans that the hospitals that they submitted to the department.
I can switch
and
between slides if you want.
Oh, okay.
Are you there?
Yes, sorry.
I can actually, I'm actually can control your slides. When you want to go to the next slide, I can do that for you. I apologize.
Oh, perfect. Okay, so I'm on slide number 6, new variant of COVID-19.
I can't count. There you go.
Thank you. And so the last thing that I will touch on is the new variant of COVID-19. I'm sure you all heard in the governor's announcement that there have been 2 cases of the UK variant identified in Maryland. He announced that on Tuesday, and our state public health lab is testing samples for this variant very regularly. And we sent out a memo to all labs in Maryland or that are contracted with the Department of Health, asking that if they're able to perform this test, and they are performing it, to provide the results to the Department of Health, and to keep us in the loop. Let us know, because we're in really close conversations with the CDC and really monitoring this closely. And the last thing that I'll say about the new strain, if you will, or the new variant of the virus, is that it's very common for viruses to change through mutation, and for new variants or strains of a virus to emerge over time. So while this variant appears to be able to spread a little more easily, there's no evidence that it causes more severe illness or has an increased rate of death. And I will say that the vaccine appears to protect people against this strain. Obviously, it's so new, researchers are still looking into it, but all of the preliminary data and feedback that we've gotten is that, well, it's a new strain, it's not any more deadly and it does still respond to the vaccine. So with that, I will turn it over to Dr. Chan.
Thank you so much, Heather, and thank you again to the delegation for having us this morning. So I wanted to talk through our vaccine update. You may have seen or heard some of it, so I'll try to run quickly through it so that we can get to the section where we can have more of a discussion. So let's go to the next slide.
How'd I do?
Thank you. Yep. Thank you so much. So wanted to emphasize, and this really not only, of course, is for you to understand, but also for our public to understand that there's a process. I think that there may be, people don't see kind of what's behind the scenes and what's happening, but there is a time frame from when the federal government actually lets us know how much vaccine we have to order for the following week, to actually determining what the allocation is, putting the order in. And then once the state puts the orders in typically on Friday or Saturday of each week, then those vaccines get delivered directly to those facilities, usually between Monday through Wednesday of the following week. So when you look at some of the numbers, like this week, vaccines distributed, some of those vaccines literally just arrived just 1 or 2 days ago. And so, it's hard to immediately then turn around and vaccinate, hundreds of thousands of people immediately, but that's exactly what they're doing is, setting up vaccine clinics in anticipation of those vaccines arriving and then vaccinating people, but that might take a few days. And so that's the other piece of it, is that, it may take between the allocation to actual arrival roughly between 6 to 9 days. And again, the delivery component is a little bit out of our hands. It's actually coordinated by the federal government directly with the manufacturers or their distributor, and can take a few days for either UPS or FedEx, depending on the carrier, to actually transport the vaccines into the state. And those go directly to the facilities. And that's the other thing I would emphasize, is that they're not coming to us, say at MDH, into our large freezer warehouse or something that we then redistribute. We place the orders, and those go directly to whether it's a local health department or hospital or federally qualified health center. And then the administration process itself early on, because these vaccines are new, and there's some very specific handling needs required for especially the Pfizer vaccine. And there's actually a certain shelf life that we learned about more and more detail only right as FDA actually approved the vaccine, that we had to train a lot of individuals around the state to make sure that they handled it very carefully so that we don't waste vaccine. But it's literally that, the moment you take some of the vaccine out, they come packaged in what people call pizza boxes, in a lot of the Pfizer vaccine. So it looks like a pizza box, I guess, but each of the vials are there. But once you pull that out, there's a certain shelf life that all of those vials need to be used in a certain time frame. So all of that has to be handled very carefully so that we don't waste vaccine, and we only take out and use and schedule appointments for what we are taking out of the freezer. So next slide, please. So we are now in phase 1B, as the governor announced yesterday, beginning on Monday, January 18th. So we have been since the beginning, since we first started receiving vaccine, of course, in 1A, which really focused on healthcare workers and nursing home residents, as well as their staff members. And so as we move into phase 1B, this will include Marylanders over age 75, as well as people who live in assisted livings, group homes, and other congregate facilities. And we also will begin including K through 12 teachers, support staff, and childcare providers. We are also working with Secretary Fielder at MHEC, looking at higher education. So just be aware that that work is ongoing. So we understand what the arrangements might need to be to accommodate critical staff in higher ed institutions as well. And as we roll forward into phase 1B, it will also include continuity of government. So next slide, please. So the other key piece that I know that we've been hearing from local jurisdictions is about how do they keep going in vaccination so that they don't stop, if they have vaccine, to keep going, especially if they had completed phase 1A. We had directed our health departments, for example, to use their vaccine to start vaccinating in assisted livings and congregate care settings, knowing that those individuals are at high risk of complications from COVID disease. But what the governor is directing local jurisdictions is to still stay with the state's plan in terms of the different phases and moving phase by phase, but that they can accelerate and move to the next priority groups within their county, if they are able to go ahead and move into that. This means that even the prior priority groups, so again in 1A, would continue to be eligible for vaccine, but that we would open up the availability of appointments to other priority groups. We know that vaccines, as we get more and more of them, we'll be able to open up more sites and larger sites as well to accommodate more people. So there is planning for mass vaccination sites across the state underway right now, working with our partners with the National Guard, who've been really tremendous in working with us really throughout the pandemic in all aspects of our response efforts. So next slide. And as we talk about National Guard, right now in terms of supporting vaccinations, they actually do have a number of different medics that are available to us and have been helping to support some of our counties, and other counties have also requested National Guard support, and they've been doing vaccinations for flu among their National Guard members in the fall, and so they have some experience in doing mass vaccinations and in conducting the actual injections in the arms. And so we so far have been assisting Prince George's and Charles counties, but again, there are counties across the state that have requested National Guard support that will help come and augment not only their vaccinator capacity, but also to help assist on the logistics end. We also have engaged volunteers across the state to actually come and assist with county vaccination clinics. And with the order that was released yesterday, this was something that we've been asked specifically by some pharmacies who are more cross-border, that now they can pull pharmacists and other resources perhaps from our neighboring states to actually come and assist with the efforts within Maryland. So next slide. With the announcement of moving into 1B, into 1B, we have activated what the federal partners are calling Part B, and so not to be confused with Phase 1B, but Part B of the Federal Pharmacy Partnership. And what that means is that there was a Part A that included nursing homes with this pharmacy partnership that included CVS and Walgreens, and we have now activated Part B, which includes assisted livings and other congregate care settings. And so this week, Walgreens and CVS started to reach out to all of the facilities that had been assigned to them or had selected them as their partner to begin scheduling clinics for those assisted livings. Because we activated this Part B, what that also means for us is that as a state, we took authorized CDC to basically withhold a certain amount of doses from our weekly allocation that would be held in reserve for CVS and Walgreens to tap into week over week to actually order from, so it would come into the state so that it'd be available for them to use as they set up and conduct these clinics. In addition, we will be launching about a week from now another program where we are working with Giant, Walmart, not Walgreens, Giant, Walmart, and Martin's pharmacy locations across the state, and beginning to allocate doses to them so that they can also assist with that 1B population. Next slide, please. As the governor emphasized yesterday, our greatest limiting factor right now is supply from the federal government. And so right now we have, the holidays, I think, changed up our schedules a little bit, including on the federal side, but now we're getting into a better cadence 2 weeks into the new year. And so what I heard, and I was fortunate to be on a call with General Perna from Operation Warp Speed just yesterday, and what he indicated is that in in the coming weeks, he anticipates that all states will remain relatively level in terms of the number of vaccines that we would anticipate getting. So right now, Maryland over the last 2 weeks has gotten 72,000 doses a week. This is to cover the entire state. Again, as we activate Part B of that pharmacy program, we will be withholding roughly 20 to 25,000 of those over the next few weeks in reserve for the assisted livings. And so that means that roughly 50,000 or so will be available for allocation to the remainder of the state and the other partners that we're talking about. So for the foreseeable future, that 72,000 a week does translate into about 10,000 doses a day. And right now, so today, for example, we reported about 18,000 doses administered that were reported in the last 24 hours. So, we are exceeding that 10,000 doses that we are currently receiving. So we will work through the vaccines that we have in our state. Next slide, please. What we continue to work with our federal partners on and push on them, of course, is the commitment to increase production. And I know that in talking to General Perna, to our regional contact as well, Colonel Rados, is that we need more and higher production from the vaccine manufacturers. And we, as many states are asking, need more doses. 70,000 a week is going to take us many, many months to get through our population, if that's all we can expect to get for months to come. But that is what we know right now. We've heard that the allocation may increase later, but again, no specific numbers. Next slide, please. As we roll forward, we have created a public website for individuals to find out more information about where they can find a vaccine. We launched that last night. More and more information will be put on this website right now. It is a relatively limited number of locations. And as we add more locations that are able to be open to the public to make appointments, we'll add that information to the website, much in the same way as we did with testing early on. If you might recall, it seems like a lifetime ago almost, but where we started out with a few sites across the state, and we still have over 250 sites that are available that people can access testing. And so we anticipate doing the same with COVID vaccine as well. We are increasing the number of providers, as I've already mentioned, that we're providing vaccine to, including like the giant Walmart and Martins that will be coming online in a week. And so that will grow over time. Next slide, please. What we anticipate is that then starting a week from now, January 25th, that phase 1C will start with the focus on the priority populations and the most vulnerable, including adults 65 to 74. And so that will start the following week. In addition, others who are in other critical infrastructure, such as in food and agriculture production, grocery stores and others would also be included. But we would ask that all of the vaccine providers that have vaccine, that they prioritize the most vulnerable. When we look at our hospitalizations, really since the beginning, it's been the group of individuals who are older than 64 who have been at the highest risk and who comprise the greatest proportion of hospitalizations. Next slide, please. So once we get into phase 2, and right now the timing may be, we want to pull that forward as quickly as we can, of course. Our initial estimate had been that it would be probably into February, late February into March for this, but this is essentially the 16 to 64 and other individuals 16 to 64, as well as essential workers would be those who would be eligible in phase 2. But if we are able to, we of course want to pull that forward and get that started sooner. And then last, I guess almost the last slide. Next slide, please. would encourage you to share this information. It is important. We're already seeing, on social media and others, misinformation about vaccine. And so encouraging people to go to trusted websites with, just the facts, just the information to learn about vaccines and other aspects of COVID. People can go to our website at covidlink.maryland.gov, or they can sign up for 211 alerts through MD Ready and by texting to 898-211. Now, I did that on my phone, so I'm starting to get these text alerts. So, so I think that it's definitely encouraging people to do that as well. And making a plan for vaccination. I think people have asked, well, what if my parents really don't use the internet? They don't have a smartphone. I will say my parents are the same. We got them a smartphone, but they never use it, and they mostly lose it until they have to try to find it to make a phone call. But, that's where we would encourage neighbors, friends, family to work with their loved ones to make a plan and work with them to find an appointment. If they need help, they can call our numbers at 211 as well. And that will get to our COVID call center, who can also assist. Next slide. It's the other thing that we've heard, and I know this is hard, that right now this is a resource that is still in limited supply. And we have heard of individuals who had tried to make appointments ahead of when their priority group might be. And, we would encourage them not to, if they can, and try to reserve vaccine for the most vulnerable populations. And now that we're opening it up to individuals who are 75 and older and others in assisted living, we would encourage that we, try to make sure that there are vaccines for that population. Next slide. Our public dashboard, we are continuing to make improvements on so that it gets more granular and more information. So is on there as we have more information. But that is something that you can certainly go on every single day. We update it daily with the information that's fed in overnight through our Immunet system. And again, we continue to make improvements. If you have any questions about it, or we are happy to entertain any questions or suggestions about what might be helpful, and we'll try to make that work for us. All right, next slide. We will be rolling out a public information campaign, and it's really to educate people because, of course, a lot of people understandably have questions about this vaccine, and so we want to be able to provide information to everyone, healthcare workers as well as the general public. And so not only are we doing briefings for leaders such as yourself, but other stakeholders. I've been doing some town halls when requested, and we have our community stakeholder group who's been providing a lot of really good detailed feedback to us about our campaign and messaging and really even venues and how we engage with trusted community leaders to help us with our messaging as well. Next slide. So this, I think, is the last slide. And so, these are important measures, as Heather alluded to, we've identified 2 cases with the UK variant, as it's known, but the virus continues to mutate. We've seen a number of mutations and changes over the various months, though it didn't really change the behavior of the virus itself. This one, though, that was first identified in the United Kingdom, does appear to have increased risk of transmission, that it spreads more easily. And so that's why it's still important to emphasize use of masks and social distancing and avoiding large gatherings. And so really want to emphasize that. So I will stop there, Delegate, and turn it back to you, and we're happy to answer any questions.
Dr. Chan, I just want for the record that you and I have never planned this interaction, and it's an example of how well the Department of Health and the legislature can work together with me handling the slides.
You did an excellent job.
Okay.
Thank you for handling
sure
the technology on this. I could not have done as well. for
Well,
you.
I'm going to take it out of the sharing mode because I'm not as good as I should be on this. And I'm going to ask the members that you're going to have a question. Be collegial, start and get through it and move forward. Okay, thank you. Go ahead, Mary.
Mr. Chair, thank you very much. And you are doing an outstanding job with our first delegation Zoom meeting in this 2021 Maryland General Assembly unprecedented COVID session. So thank you for your leadership. I want to kind of boost you up there. And I was delighted that on the agenda that we would have this briefing from Dr. Chan. And Dr. Chan, I want to thank you. I want to thank you for your leadership, but I especially want to thank you for listening to the on the ground local health officers. And I know all of us in this delegation are proud of our local health officers. I, of course, believe that I have the best ones in Worcester, Wycomico, and Somerset counties with Becky Jones in Worcester and Lori Brewster having 2 counties, Wycomico and Somerset. And when they were coming to us, they did it in such a professional manner, basically coming to us, the delegation members, and saying, look, you know, we're ready to go to that next phase. And, you know, we just, you know, we want to get these vaccines out, and we don't need to wait for the rest of the state. And, you know, hearing Governor Hogan's announcement last night and that local flexibility, and also knowing that, you know, every group believes they're a priority and should be vaccinated now. So the pressure that you're under, I wanted to, first of all, recognize, you know, and commend you, but also make sure you're hearing that our local health officers are doing such a good job. And to ask you to continue to take their feedback to heart. And, you know, we're translating that and with the, you know, with the governor's staff as well. But I just thought it was important. And I wanted to ask you, as far as logistics, now that this big announcement has been made by Governor Hogan last night, all of us, a lot of us are trying to put the information out there and direct our constituents in a way so they don't become more frustrated. So I know that you have, I saw, you know, you've got your website and link up. And I know the local health departments have theirs, and also that you're encouraging people to make a plan. Anything more on that? So we're giving our constituents the best information as quickly as possible, and so they don't feel like they're having, you know, to make another call and become frustrated, trying to make this constituent friendly, especially for the elderly and vulnerable populations.
Well, thank you, Senator Carrozza. And I would agree, you know, I'm on the phone with both Becky and Lori every week, sometimes several times a week. And so I know how hard they're working, one, and two, how well they're doing. And really, you know, I'm on the phone with the health officers, you know, across the state, both, you know, jointly, and we have a call later today, every Friday, and we have another call with all of them every Monday, in addition to all the other calls that I do personally with them. So yes, I mean, I think that really the crux of and the backbone of much of the work that we've done with COVID response really has been with local health departments, and so we're very, very grateful for that partnership, and just you know, having come from the locals myself, and these are my colleagues. I was a health officer in Anne Arundel for some time, and so I know the work that they're doing. And so to your question, you know, that's why we launched the COVID Vax website. It is the beginning, and we are, you know, all of the local health department information is on there, so that people can reach out to their local health department through that website. But it is, and the local health departments are using one platform for their appointments. But again, the appointment times and dates may vary, of course, by jurisdiction based on, you know, what their available staffing is, is, and of course available vaccine. And so it is going to, there's still a limited vaccine. So we would urge patients for individuals as they try to make a vaccination clinic that they may not get it, the day that they want it. It may be still a few weeks out. And so we would urge patients for individuals as they're making appointments. Again, as we're dealing with 72,000 vaccines, I know that, if I gave all 72,000 to the Eastern Shore, they would use it. It would all, it would be done. But because we are, trying to carefully allocate across the state, and other jurisdictions as well are saying, give us more vaccine. And I really would like to be able to fulfill that. So
And my last comment, Dr. Chan, and I'll hand it back to our chair, is you mentioned involving pharmacies, and I would encourage you to include our local pharmacies, our smaller pharmacies, community pharmacies as well.
thank you.
Members, I'm able to identify the hands. I have Mike Griffith next.
Thank you very much. I appreciate it. No, just a quick question. So I've been reading the literature and some of the vaccinations, especially Pfizer, and it mentions that children under 16 cannot take the vaccine as of yet. And I know one of the big issues we're all dealing with right now is trying to get kids back into school. And I'm grateful that teachers have been prioritized in this process. But I've also heard from some teachers advocates that just having the teachers vaccinated may not be enough to get kids back in school. And with, again, from what I've read, at least with the Pfizer vaccine, that kids under 16 can't have the vaccine. What is your opinion if the teachers get vaccinated? Would that put us in a posture to allow kids to go back to school?
Well, yes, I think that we have seen examples on the Eastern Shore that even pre-vaccination, that you can bring kids back to school and still have a successful, or at least some in-person education. So I think that waiting for the vaccine trials to be done for kids that are younger than 16 and waiting for that approval to happen and then vaccinating all of those kids, we might be here until, 2022, 2023 before that happens. And, we got to do better for our kids and, get them back into the classroom. So I don't think that waiting for having the vaccines approved for children is the approach, and that would be my my message.
Thank you very much. I really appreciate that.
Delegate Hartman.
Thank you, Mr. Chair, and thank you, Dr. Chen, for the great work you're doing. Two questions, if I may. The first one, you hear a lot of different thoughts and rumors to how long the vaccine will protect somebody for once the second dose is administered. Can you help me with that?
So, right now they're continuing to follow the participants in the clinical trials for both Moderna and Pfizer, and they'll be following them for a total of 2 years. So the initial data that was put out for their approval, for the approval by FDA, only followed them for about roughly, I think it was about 4 or 5 months. And so I don't know if we have good information yet about long-term immunity, unfortunately. So it's still to be determined whether or not these individuals might need an additional booster dose in a year or 2 years from now. So unfortunately, we don't have good information about that yet.
Okay, thank you. And following up with Senator Cruz's question about this, including the small pharmacies, if some small pharmacies were interested in participating, how do you want to us to go about getting that information to you as far as those who are willing and wanting to be involved in that process?
So, our Immunet system, we have just recently opened it up to other providers. We're initially targeting our primary care physicians and our federally qualified health centers to get registered. And again, registered does not necessarily mean an allocation will occur, but it at least prepares them to. So those pharmacies could engage with us by going to Immunet and beginning to that registration process. Right now with the federal retail program, this is an engagement on the federal side where we can actually do easier and direct allocation to them to the Walmart and Giant pharmacies. And this is to improve access, but we would encourage the independent pharmacies to begin registration as well.
I would just like to stress the importance to you as the state health officer, protecting and helping those small businesses. So I'd love to see something expand further into that.
Thank you for that comment.
Delegate Hartman, if I may, this is Heather Scheck. They can also, in addition to my OGA role, I'm on the vaccination team and the demand management. And so if you have any small business owners or small pharmacy owners that are interested in becoming vaccinators, they can actually reach out directly to me, and we can get them additional information and get them on our in addition to the Immunet list, our internal list.
Okay,
and I'll put my email right in the chat box.
Very good. Thank you.
You're welcome.
I do have a couple questions, but if there's any other from the delegation that has a question, could you please raise your hand? Or going once?
Johnny Mount's here.
Okay, Johnny, go ahead.
Real quick question for Dr. Chan. So if we're getting contacted from individuals that want to be moved up in groups of consideration, specifically, the people who are doing the sanitation work want to be classified at a higher level to be up in the queue for vaccination. Are those determinations made by our local health officer, or are they made by the state?
We have been taking those and, trying to put those into our calculus for, for prioritization. Again, we are trying to have our prioritization be at the state level, and then asking that the locals, even if they move ahead within the prioritization groups, that they follow the priority groups that the state has determined. So with sanitation, I believe that they, and I don't want to speak offhand, but out of turn, but there is an element of they would be potentially considered part of the critical infrastructure and workforce, and I believe that would be in either phase 1C or 2, but I'll make sure of that. And I'm just pulling up my slides just to make sure that I'm not speaking out of hand.
Or after the meeting, we could follow up with that just to verify. Again, that was a comment that we received. Thank you for your response.
Any other questions before me? Okay, barring none. Dr. Chan, thank you very much for coming. I just had a couple questions and trying to help out a little bit. Local health officers have actually been calling around trying to get people to take this vaccine because the numbers aren't coming in as quickly as we can, but they're having frustrations again when you start listing the names and who you can vaccinate. I just wonder why we aren't allowing more control to that level, because I got a call the other day because they were going to have to throw stuff away. It was going to go bad. And I'm not advocating that these guys have complete control where they can give to anybody they want, but certainly there could be loss here because we're maintaining such stringent control.
So I think that, what the message is, we don't want to waste vaccine. So, we would not, if they think that they're in a situation that they might have to throw a vaccine away, I would ask that they call me. And I've not gotten any calls or any indication to that effect. So if you're hearing that, I would want them to call me and the particular situations. So we, every vaccine is precious. We want every vaccine here in the state to be used in somebody's arm and prevent disease. So, we've opened it up as well and are allowing local counties to move forward so that, again, if there's reluctance in certain groups, that we can keep going so that we don't stop.
Okay. The other thing, I noticed that we have, you addressed this a little bit, and I've been busy doing a lot of things here trying to maintain this, but you met the teachers, I guess, is an issue for me in a sense of, is this saying that we're pre-doing them because they're not able to teach yet we're prioritizing them over some people and they're not actually interacting with the children yet face to face? I understand those that have to should be vaccinated, but a lot of our classes are still virtual, and I'm wondering why we've prioritized them.
Well, because, what we want to move towards is bringing the kids back into the classroom. And so what we have talked about with and working with Dr. Salmon at MSDE is, she's been talking to the local superintendents about how they would bring kids back into school, who they might prioritize, initially based on, say, if they prioritize all of the special ed kids or the high risk kids who are not doing well with distance learning, that they might prioritize those staff first. So it may not be all of them. We're asking that they prioritize as well, perhaps, as they look at how they might bring kids back.
Okay. And I appreciate that. I understand that. But the other question, when you say that, how fast does this vaccine work? If I get if I get vaccinated today, when am I quote unquote fixed?
So it's both vaccines. The trials use 2 doses. So it's either 3 or 4 weeks apart. And we anticipate that there is a immune response after the first vaccine, where there is some little bit of data that suggests there's some immunity after just 1 dose, but really it's after the second dose that that you can achieve that 95% effectiveness in preventing disease, but that usually doesn't happen until 2 weeks after that. So it could be between 5 to 6 weeks.
Okay, so I'm assuming then that the intent of the school is to get back to school within 6 weeks, because we put these people in this next release, and then the following week we can go to phase whatever it is 2.
Mm-hmm.
So assuming that that's the mission if we're going to vaccinate them. And if that's not the case, I don't understand why we're not taking care of those in need faster, as opposed to blanket. Say, I know that hospitals went out and did some things. We saw something in the paper a week or so ago. They vaccinated a whole lot of people, and not necessarily the people that are in the front lines. And my last thing that I'll bring up is the fact that I'm understanding so many healthcare frontline employees are not taking this vaccine. Mm-hmm. And that goes back to the whole thing about why aren't we allowing these doctors, and we have a doctor in our county, why aren't we allowing them to make the decisions when they can distribute and who?
So we would like to get to that point. Absolutely. Again, we're very limited in terms of how many vaccines we can allocate to even individual providers in the community. And so we're expanding that as quickly as we can based on the volume of vaccines that we get.
Okay.
So
last thing I want to say is you have an employee over there, Webster Yee, who's been tremendous. Mm-hmm. He's doing so much, trying to do so much he's got to work on the guidelines. I really appreciate his help. Any other questions for the good doctor?
Yes, Chairman Aaron's, just Delegate Sample Hughes.
Go ahead. Thank you.
Dr. Chan, I know you're probably tired of seeing me.
Not at all. Not at all.
But I do appreciate your help and all the updates you provide us on the work group that we meet regularly on. And I thank you again for raising the point that you're looking for higher education to possibly be phased into that mix with the 1B. What now what that timeline may look like? Is maybe like 2 weeks or 3 weeks? Or I'm just curious because we do have some of our higher education institutions on this call right now, and they're getting ready to ramp up to get back in their classrooms and students back on campus. So I was just curious, is it
I don't have a specific time frame. I will say that the message would be the same as I gave to the local superintendents just earlier this morning, actually, is that, again, we would ask that they prioritize in terms of which groups of individuals that they might, kind of offer a vaccine to first. In terms, the frontline staff, for example, more so than others. And it's because we're not able to provide vaccine immediately as one big, large number to any individual group at this point in time across the state. So it may happen over a few weeks. And that's the message that I had for the local superintendents, that they also prioritize. And so those plans are coming into place. We're working with Secretary Fielder to understand what those numbers might look like across the state at different institutions. And again, different institutions have slightly different resources to be able to plan for vaccinations, whether it's working, they have their own robust school health or university health system, or they're working with their local health department or other partners.
Okay, thank you.
Any other questions? Dr. Chan, again, on behalf of the delegation, thank you. We appreciate the information and we appreciate all you're doing. I mean, you're a staple out there. Great job.
Well, thank you, sir, and thank you to the delegation and particularly to the chairman for also being our technical guru today. So we'll come to you now for all our
Shucks, it was nothing.
Thank you, and have a great weekend. Thank you for everything that you're doing, and hope that this session goes well. So
Thank you. Okay, moving right along. Our treasurer's report, Delegate Adams, if you're on board. Is Chris Adams with us?
Right here, right here. Hey, Steve.
Go ahead. Please go ahead.
Are you ready for the treasurer's report?
That's the only reason I call you, sir.
That's okay. All right. So I sent everybody information last night. Just very briefly, we've got a beginning balance on January 1st of 2020 of $3,154.35. Received deposit of member dues of $50. And then we had one check written for flowers for Delegate E. Murray's funeral, $118.99. There was a check fee because this is a savings account, not a checking account, of $10. Interest earned on the account of $1.13, leaving an ending balance as of December 31st, 2020 of $3,076.49. Mr. Chairman, you'll remember that we decided a couple years ago to just do one $50 fee per member over a 4-year period, and I'll reach out where necessary to collect the remaining dues, and be glad to answer any questions if anybody has them.
Any questions for our treasurer? Seeing none.
Quickly, if I could, Mr. Chair, instead of paying the $10 bank fee, could we just do a withdrawal and have our treasurer issue a check or something to avoid those bank fees?
Delegate Hartman, I think the way that this was set up, this is the original account that was set up maybe in the early 2000s, and the frequency that we're writing checks is so maybe 1 or 2 a year. This check fee is balanced against the possibility that we would have monthly bank charges. So the way this is working is we're only being charged anytime that we take a withdrawal, and unless somebody wants to change things, and if we change them, it's going to require setting up a new type of account. And at the end of the day, we decided, my aide decided just to leave it the way it is.
Okay, that's fine. Thank you.
Yeah.
Any other questions for the good treasurer? I do have a couple little things I want to touch on. I do want to give our federal partners a chance to say something. Kim, if you want to double dip, by all means, if you can unmute yourself, or do we have to do that for you? Can't find you.
I'm here.
Okay,
Sorry.
can you go ahead?
Yeah, I just thank you for having the senator today. And I have asked, per his request, that I send out his small business and COVID guide to you all, which I sent him already, and she's going to send to all the delegation for your information. Just keep in touch. You all know where to find us. I know Melissa's here as well, and she may have something to say as well, but just thank you. Thanks. Keep in touch. You know where to find us.
Okay, thank you very much. Melissa?
Yeah, I'm just glad to see everybody's face. I know we've been intermittently meeting, but yeah, some unfortunate events in DC. Thank you for all the concerns. We also received those calls in our office. Been working with several of you throughout these times, just trying to keep you informed as best we can. As you know, things are such in limbo, just like with the state of Maryland. Steve, I will ask, if this is not on the agenda, could you have somebody from Maryland Unemployment address the delegation?
We are trying.
We
are trying
at the federal level are managing.
I'm sorry, go ahead.
As many cases, if not yours. I mean, we're up to 2,000 in our office, and we'd just like some insight on that. But yeah, you know how to get us. And
I would reiterate Melissa's concern about that.
Yeah, we're here. Senator's scheduled to be with you on February the 26th. So if you have anything particular you'd like him to address, please send it my way. thank you for the opportunity.
Okay, I don't know if we have a representative from Andy Harris with us today. Would like to say anything?
I think Keith was on the phone.
Okay. Any other business before the body? Because we're running a little late. We're over time. And any other business anyone wants to discuss? Good. Okay. Listen, I thank you all for all your patience here. This has been a tremendous learning experience for me personally. And hopefully we'll have all these glitches, the little bit that we had, because it was great time, but we'll have these ironed out for the next meeting. I do know a lot of people have told me they got to get to another meeting. So next week, look for us and we'll talk to you in the future. Okay. Thank you very much.